Well, the clinics offer significant safeguards to the patients. And although part of cannabis is legal, the CBD component, the problem with that product is that it doesn't often have the richness of the other cannabinoids, and particularly it doesn't have the consistency and not necessarily the safety or the quality that you'd want from a medicine. So the advantage of the clinics is we would use and only prescribe proper cannabis, if you like, that is produced to a high standard, so-called GMP standard, that's good manufacturing practice, which is like it's a pharmaceutical standard. So you know what you're getting is what's in the bottle, is what's on the bottle. And that's important. So every bottle is the same, you've got consistency, you've got safety, and in particular, we can prescribe the THC component, which you can't get online, is not legal outside a prescription. Within the clinics, the patients can expect to see a relevant consultant for their particular condition. Most prescriptions, on the basis of experience from Canada, for example, is that about 70% of prescriptions will be for pain. And we know for certain that cannabis in various formats helps all sorts of pain, from nerve pain, arthritic pain, cancer pain, basically any sort of pain can be assisted significantly by cannabis. But it also helps a whole variety of other things for which you might need to see a different specialist. It helps spasticity, that's muscle spasm in the context of brain injury or stroke. It helps epilepsy, that's well known from the media. It helps drug-resistant epilepsy, not only in children but in adults. In other contexts, you might see a psychiatrist because it helps anxiety. It might help obsessive-compulsive disorder, for example. And another particularly important thing is a gastroenterologist, because there's no doubt it also helps people with Crohn's disease or irritable bowel syndrome. I think many patients coming to cannabis will be worried about it. They'll be concerned. They won't have had experience of it necessarily. And what we can offer in the clinic, I think, is several things. First of all, a quality doctor. So they will be prescribed by a specialist who's particularly familiar with that condition. So they're able to prescribe sensibly, with a good quality care and good quality follow-up. That's just as important. Not to get the original prescription is important, but also the follow-up and the care afterwards, because people may be concerned, is this problem I'm getting part of a side effect or not? They'd want reassurance, they'd want help, guidance about dosage, and we can offer all that in a good quality clinical service. For some people, the improvement of quality of life is dramatic. Particularly, take for example the children with epilepsy. We've had children with hundreds of seizures a month, and those seizures have literally stopped on cannabis. And their quality of life is therefore improved immeasurably.